Good afternoon. My name is Burton Weston. I'm joined today by Adam Berkowitz, who's chair of the Corporate Reorganization and Bankruptcy Department at Garfunkel Wild. Together, we bring about 70 years of experience to the restructuring arena, having worked on mega cases, mid-market cases in all market sectors. And today, Adam, why don't you share what we're going to be talking about?
Thanks, Burton. So, we often find that when folks come to us with financial difficulties, they don't really have a firm understanding as to what can be accomplished and how bankruptcy works and how restructuring works in general. So, what we really like to do today is we'd like to demystify the bankruptcy and reorganization process a little bit, specifically in the healthcare context. We'd also like to provide you with some of the basics of what can and can't be accomplished in the bankruptcy arena and discuss some strategic alternatives to consider when you're experiencing financial distress or if you are anticipating that there are going to be financial problems in the near term.
Our focus today is going to be on the debtor side of the equation. There are issues relative to the creditor side, such as when you're dealing with a financially distressed creditor or a creditor who files bankruptcy. It's not going to be the topic of today's discussion, but we invite you during the Q&A to approach us if you have questions in this regard. For example, regarding application of payments, to prevent potential clawbacks for preferences or fraudulent conveyance, how to approach non-paying creditors, and the like. As I said, raise those with us during the Q&A or even after the fact. So let's talk about today's topic and why it takes on importance in today's environment. I think the healthcare industry today continues to be impacted by financial pressures, probably to a greater degree than ever before. We're confronted with declining and delayed reimbursements, reduction in government grants and other support to a significant level versus historical levels, audits, be they government audits or audits by private insurers, certainly rising costs, the potential of administrative efficiencies. I think changes in healthcare delivery models have proceeded at a pace that far greater than administrative changes, which sometimes result in bloated cost centers and the like. Increased capital expense requirements. For example, having to address EMR requirements in years past. And regulatory expenses in general to meet government-imposed requirements.
And in particular, over the last 15, 20 years or so, what we've also seen a lot of is consolidation. We've seen the decline of the standalone community hospital. We've seen physician practice groups grow increasingly in size. We've seen skilled nursing facilities consolidated, and hospital systems go through a series of consolidations as well. As that continues to grow, the balance sheet doesn't always line up with your ongoing obligations. You end up with some legacy debts in there, whether they be from a pre-merger obligation, whether they be pension obligations, whether they be founder buyouts in a large practice group. So there's a lot of different things that come up in that arena. And there's also been a growth of MSO arrangements. And as those have come into play, they're designed to be able to be sustainable based on a future income stream, future cash flow. And sometimes they're not. So all of these things, they lead to some instability. They can lead to problems down the road. And really what you're faced with is an inability then at that point to pay your current obligations, make your payroll, make your rent, pay your vendors. And that's really where your problems start to arise.
So let's understand what bankruptcy is. Simply put, it's a set of federal laws that can be utilized by a variety of legal entities, both for-profit and not-for-profit, and are designed to allow for the restructuring of financial obligations, potentially the sale of assets, or even the liquidation in an orderly manner. There are two main types of chapter proceedings in connection with businesses. One is Chapter 11 reorganization, which we're going to discuss in detail today. There are two foundational aspects to that. One is to provide a breathing spell to debtors, and the other really is to allow for a fresh start. Not the subject of today's discussion, but you'll, I'm sure, hear reference to is a Chapter 7 liquidation. And in that case, the business operations discontinue at the time of the filing. A third-party trustee is appointed to administer the wind down of the business and the disposition of assets. But our focus today is going to be on Chapter 11.
So, what is Chapter 11 exactly? At its core, Chapter 11 is a process by which a debtor restructures its finances and to a certain extent its operation. One of the key takeaways, and we'll talk again about this a little bit later, is that when you file for Chapter 11, existing management, the existing board, they retain control, albeit with additional oversight of a bankruptcy court, but they retain control of the process. A lot of times folks come to us and they believe that if they file for bankruptcy, they're immediately giving up all control over their business. That is not the case. Then what happens next? You're looking to restructure your financial obligations. Examples can include taking your debt and converting it to equity in certain instances, depending on the ownership structure and what is or isn't permissible based on regulatory requirements. Sometimes it's a straight compromise of debt with your existing lenders. Oftentimes, by cleaning up the balance sheet and right-sizing operations, you can attract new capital, whether that be in the form of additional debt or an equity infusion. And when I talk about operations, we're talking about a couple of different things. One of the biggest cost centers and one of the biggest issues in healthcare is dealing with your workforce. Sometimes it just got too large over time. Sometimes it's misallocated. So the bankruptcy process really allows for, a reconfiguration of your workforce. It has some provisions that allow you to right the ship in that regard. Another thing that the bankruptcy process is really good at is eliminating costly and burdensome contracts. And when we're talking about contracts, we're not only talking about contracts with your vendors, but we're also talking about leases. And that can be equipment leases, it can be real property leases, and the like. And this is done through a concept called rejection. And it allows you to really take a deep dive, look at where your business is at, operations and the like, what you need on a go-forward basis and what you don't need. And it really does, it provides you a mechanism to jettison those agreements that can be bringing you down. Another aspect of the Chapter 11 process, in addition to saving the core business, is what do you do with your excess assets, your excess properties, properties that you no longer need, legacy properties and the like. Chapter 11 process is great at helping you monetize those assets. And all of this is really with an eye towards obtaining a fresh start. An alternative use of the Chapter 11 process, in addition to a standalone reorganization, is to use it as a form of distressed M&A. And there are provisions in the bankruptcy code that really allow you to effectuate a going concern sale of an underlying business and bifurcate it from some of those legacy debts that are otherwise drawing that business down. In some instances, existing ownership can maintain a role in the post-sale entity, and in others, it's a complete walkaway. And again, it also provides, in the sale context, a forum for an orderly liquidation of the remaining assets and resolution of all of the other bankruptcy claims that get left behind.
I think, look, with either path, our experience is that an organization's best chances of success in reorganization is to be proactive rather than reactive, to start planning at the earliest signs of distress. And the sooner you seek assistance in addressing underlying issues, be they financial, be they structural or otherwise, I think the more likely you are to be able to develop a viable plan. That plan needs to include what? You need to clearly define your goals. You need to make an honest assessment of the achievability of those goals. In other words, are you going to look to reduce footprint? Are you going to look to consolidate? Are you going to look to increase census and change marketing plans? You need to go forward. You need to develop go forward business plans and budgets, including short-term, medium-term, and long-term projections. What cash flow do you have at this point? What cash flow requirements are you going to require in the next 13 weeks, in the next 6 months, in the longer period of time? What are your staffing requirements? A critical, honest assessment is absolutely essential. Now, albeit that can be difficult, particularly when there's long-term ownership and historical relationships, but frankly, that can be the difference between survival and failure. In all cases, the assistance of a third party can help. be it developing business plans, be it doing an assessment of your workforce and workforce allocation. But in either case, don't be disinclined to seek out the input of financial experts.
And another area where, additional outside assistance can really come into play and can really help you is if you are pursuing some sort of sale or partnership strategy. You might need help identifying potential partners or potential acquirers and purchasers. In some instances, they can be strategic buyers, and in other instances, they can be direct competitors. So while you're out there going through this process, you also have to make sure that you're preserving and protecting your business. And that's another area that professionals can help you assist with is how much information to be giving out, how to go to market, how to protect information that's being disseminated, whether it be through NDAs, through limited resources, redacted information, and the like. So, there's all sorts of things that consider as you go through these various processes. Another thing that you're going to need to consider, Burton had mentioned earlier, putting together cash flows, budgets, and the like, is what those funding sources are going to be. Do you have the ability to fund it internally through operations? Or are you going out to your existing lenders? Are you going out to new lenders? And there's strategies associated with all of that as well. You don't want to go to your lender too early to tell them that you're having financial difficulties. But once you have a plan in place and you know what your asks are going to be and what your requirements are, you are going to want to speak with your existing lenders. You're going to want to be speaking with new potential lenders. And so all of that comes together. And again, professionals can really help you thread the needle, as you're trying to navigate that particular aspect of the process.
So what are the key features of Chapter 11? I think you'll recall I spoke a moment ago that the bankruptcy process is designed to give a debtor a breathing spell. Often, by the time bankruptcy becomes a serious consideration, a debtor is faced with oftentimes multiple lawsuits, alternative collection actions, the enforcement of judgments, and creditors' attempts to lien assets or seize bank accounts. So how is that breathing spell achieved? When a bankruptcy case is commenced, statutory automatic stay comes into effect. That stay stops all lawsuits, all collection efforts, prevents creditors from moving forward in any manner from that point on, and consolidates everything into a single forum. So instead of litigating in multiple forums, everything comes within the bankruptcy code. So how do you file? The filing was really occasioned by the filing of a petition, together with so-called first-day motions to allow for a smooth transition and continuity of operations, motions to allow you to pay pre-petition wages, motions to allow you to maintain your bank accounts, to continue your insurance payments, to continue business in the ordinary course.
So it's interesting. I mean, we're talking about entities here, right, that are dealing with lawsuits, dealing with collection efforts, potentially having trouble making payroll, having trouble paying their rent and the like. And yet we're talking about seeking, additional professional assistance, going through a process that has additional oversight and requirements. How do we address it? How do we pay for some of that?
Well, statutorily, the debtor is not permitted to pay any obligations that became due immediately prior to the filing. So dollars that you expended to keep creditors at bay, the extra money that you put out to keep things quiet, that all stops. You must pay all obligations going forward on a current basis, but it does free a degree of cash flow by virtue of the halting of pre-petition payments, and that can go a long way towards funding a bankruptcy. The other component is alternatively what we call DIP financing or DIP financing. Lenders providing new money into the Chapter 11 entity. It may sound counterintuitive, but there are reasons to do it. You may have an existing lender who's looking to shore up its position and will put additional money out to protect it. Or if there are unencumbered assets and depending upon the collateral base, new lenders may come in, take a priming lien position, and be able to charge higher interest rates and fees. So it can be a profitable venture for a lender. So who controls the process? As Adam said before, absent extraordinary circumstance, existing management and board remains in place. They continue to manage the entity throughout the bankruptcy. albeit with additional bankruptcy oversight and creditor oversight. The end goal is confirmation of a plan, which is akin to a court-approved contract, if you will, between a debtor and creditors, and addresses those frozen pre-petition obligations that occur at the as by virtue of the filing.
So that's a lot about Chapter 11 in general. But there's also some specific issues that arise in the context of a healthcare bankruptcy, a healthcare reorganization. And first and foremost among them that comes to mind is patient care and patient safety. We're not dealing with a widget factory here. We're dealing with real lives and people's health and well-being are really at stake here. So what happens? How does all of that work? First, there are continuity of care considerations that are going to come into play. You really are going to want to make sure that you've lined up what's necessary to keep certain core operations going at a minimum. Those can include making assurances for the payment of physicians going forward, making sure that certain key contracts are in place and the like. Another thing to keep in mind is that there's a lot of oversight in the healthcare industry, and those regulatory requirements don't go away when you file for bankruptcy. So you also have to be keyed in to how that's going to work with the interplay of this new oversight of a bankruptcy court. Timing and the like, when you approach different regulators with various issues, whether it be for a transaction, whether it be to seek approval for certain changes, to close certain departments and the like. So there's a lot of interplay there. And the bankruptcy court and Congress understands this. And one of the things that Congress saw fit to do was to create a role for something called a patient care ombudsman. Patient care ombudsman is a statutorily appointed individual whose sole job it is to review operations and to report back to the court and back to the United States Trustee's Office, which is a department of the United States Justice Department. And really make sure that as we're navigating this bankruptcy process, we are also continuing to ensure that a focus on continuity of care and patient safety is at the forefront. Other issues that arise in the healthcare context that are a little bit different than, your typical widget factory, you have your medical records. And there's a whole panoply of regulatory issues that I'm sure you're all very used to dealing with and addressing. Again, those don't go away once you're in bankruptcy, but Congress did see fit to add some provisions to the bankruptcy code to allow some modifications with some notice requirements, and they really did try to balance the requirements of the patients to have access to their records and the realities of a distressed entity and what it can afford to do and not afford to do with respect to maintenance of those records and various provisions going forward. Another big issue in the bankruptcy context when it comes to healthcare is how do you deal with provider agreements? Anybody who's tried to do a regular transaction, a sale of an entity that has a provider agreement, knows that there's various issues and nuances and timing issues that go along with that. In the bankruptcy context, those issues remain, and there's been a wealth of litigation and disputes over how to treat them and how to transfer them over the years. But needless to say, it is something that is achievable. It is something that is feasible. And over the years, there have been processes that have been developed to ensure that that happens. Here in New York, especially, a lot of your hospital systems, a lot of healthcare providers are also not-for-profits. And not-for-profits have an additional overlay of issues and concerns when it comes to the bankruptcy arena. Typically, bankruptcy is designed for expedience, it's designed for speed, and it's designed to maximize the value of certain assets for creditors while trying to maintain going concern value if possible. When you have a not-for-profit, you now have an added overlay of mission-driven considerations that can, in some instances, trump creditor recoveries. It can dictate who you can transfer certain properties to, who you can transfer certain assets to. And then the other thing to consider when you're dealing in the not-for-profit sector is how you get certain approvals. Outside of bankruptcy, there's an attorney general process that's required to go through for a sale of all or substantially all of an entity's assets. The bankruptcy court and the bankruptcy code has taken that into consideration and has its own mechanism in place to ensure that the compliance with those state regulatory issues with respect to not-for-profits are abided by, but at the same time, you can effectively navigate it to really get the results that are necessary.
So let's talk about some of the benefits and some of the risks. The potential benefits, as Adam indicated, you stay in business during the course of the restructuring. Business continues, I won't say as usual, but it continues in the ordinary course. You do have the ability to renegotiate and reject burdensome contracts. Leases of real properties that may no longer be necessary can be jettisoned. They may be able to derive value for the benefit of the debtor and the estate as well. You may have below market leases on properties that you no longer require that bankruptcy code lets you assume and assign, and that a creditor may be, that a buyer may be willing to pay value for to step in the shoes of a debtor if there's an extended period of time left on the lease. It stops collection lawsuits. The automatic stay triggers. Everything gets consolidated into one form. You're not dealing with multiple litigations any longer. There's a much more orderly claims administration process that the bankruptcy code provides in terms of how to calculate claims, how to resolve claims at the end of the day. It also offers the opportunity for new investment. We talked about cleaning up a balance sheet, whether it be through a debt and equity swap, whether it be for a compromise of debt. But at the end of the day, with a cleaner balance sheet, it gives you the opportunity for a new investment or to attract a strategic partner, perhaps a strategic buyer, but in any case, to continue the ongoing nature of the business once you emerge from Chapter 11.
So, in addition to the benefits, look, this is Chapter 11. This is bankruptcy. It is not without its own risks and challenges. And one of the things that Burton and I pride ourselves on is the ability to help our clients, navigate those challenges and mitigate those risks. Among the challenges that are faced, you're going to be obligated to pay for certain costs for your creditors. They're going to have representation in the process. You're going to be dealing with intense court oversight. They're going to be looking at your go-forward actions. Anything that's outside of what's considered the ordinary course requires express court approval. But the scrutiny goes beyond that. They not only look forward and look at your current actions, but there's also a look back period where they're looking at past actions. They want to understand how you got where you currently are, what actions were taken in advance of the bankruptcy, which is why the process leading up to the bankruptcy is important as well. In addition, this is filing for bankruptcy. There is the potential for reputational damage, which can then have a cascading effect. We found, though, this is one of those areas where the risks associated with it can be mitigated by going out with the proper messaging, ensuring that you have the proper story to tell to your employees, the proper story to tell to your vendors, and the proper story to tell to the public and your patients as to what it is you're hoping to achieve, why you're taking the actions that you're taking, and what steps you've implemented to ensure patient safety, continuity of care, and really where you hope to be at the end of the process. And then finally, you do have the risk in this process of not being able to reverse it if things don't go as planned. And you're going to have to be able to turn a pretty large ship on a dime if that happens. And there can be a lot of issues that arise throughout the process that are unexpected and the like. And the ultimate risk is, while your goal is going to be to continue and maintain a going concern, is that there's the possibility for a liquidation. But that's something that, like I said earlier, we have a lot of experience in helping folks navigate that process and try and mitigate all of those risks. I mean, over the last, 20 some odd years, we've been involved in all manner of healthcare bankruptcies, whether they be in court, out of court, or the like. Some of them have been in the Chapter 11 process, and others have been well before you get to the Chapter 11 process. And we've represented hospitals, hospital systems, nursing homes, physician practices, both large and small, as well as, a multitude of social services agencies, including what I believe are two of the largest social services agencies, to navigate the Chapter 11 process. And we've managed to help a lot of these entities navigate that process by preserving continuity of care, ensuring continued access to services, and the like.
I mean, that's often accomplished in interfacing with the state and federal agencies that oversee your operations. In connection with one large social service agency that treated about 125,000 clients during the course of a year, we were able to transition over a course of 30 days after the filing about 350 programs. And that was really accomplished through rigorous interfacing with the state agencies that oversaw the programmatics of the social services agency. So that's of critical importance that those agencies continue to oversee the business of the debtor during the course of the Chapter 11. So dealing with the Department of Health, dealing with state agencies is a matter of course. There are real estate transactions that arise. We've had large hospital cases where there have been very significant real estate dispositions of excess properties, realizing major dollars for the benefit of the debtor and for the benefit of creditors. Financings, both restructuring of existing financings or new financings that you would incur, as we call for exit financing, to fund the restructuring and fund the go-forward business of a successfully emerging Chapter 11 debtor. It'll give rise to employment issues. We talked earlier about misallocation or bloated employment forces. It can often give rise to WARN cases, significant priority payments, and those need to get addressed and dealt with in the context of bankruptcy. There's legacy debt, whether that are pension issues, interfacing with PBGC in terms of ERISA obligations, or, for example, founder payments for senior partners of a healthcare organization that aren't funded during the course of the ongoing business, but are intended to be funded out of profits. Those are all issues, in many respects, unique to the health in the healthcare context.
So it looks like we're bumping up against the end of our time here today. And so I think that, to recap, Burton walked through a bunch of the items again, but really the earlier you seek assistance, the better your chances are and the more alternatives you're going to have in terms of restructurings on a go-forward basis. There's a lot of room between experiencing financial distress, experiencing financial pressure, and filing a Chapter 11 case. And along that spectrum, folks have come to us at various points in time. And I think by and large, Burton would agree, those folks that have come to us earlier have had more options, have been able to effectuate workouts. Some of them have avoided the Chapter 11 process entirely. Those that had to go through the Chapter 11 process went through with a better chance of success. And at the end of the day, really, that additional time made all the difference in the world. If you have any follow-up questions, Burton and I will be available during the Q&A session later this afternoon, whether it be on the presentation today, whether you have questions, as Burton mentioned earlier, with respect to creditor side issues, we're happy to answer them then, or obviously you can reach out to us directly, and we're happy to walk through the specific issues that you or your entity is facing.
So we want to thank you for spending the last half hour with us. Look forward to seeing you later this afternoon, and enjoy the rest of the seminar. Thank you.